Hi, this is Dr. Andy's daily COVID-19 tip. This is tip number 2, and that tip is to get outside. So there are a couple of reasons that I think it's a good idea to get outside. The first I'll show here is the sun. Okay, so why would the sun be a reason to get outside? There are a couple of reasons. First of all, it's good for your brain, right? Good for your mental health. If I can get this pen open, there we go. Good for your mental health, okay? So it's good to get out and see some sun. That's a good reason in and of itself. Another good reason though is to get some vitamin D. Now, vitamin D we know is important for your immune system, and while we can't say for sure that vitamin D is going to solve everything, or we really can't say that at all, but there is some research that seems to show that people that have severely deficient vitamin D levels are at a higher risk of having significant complications from COVID-19. In fact, in one particular research group, they found that people that had a severe vitamin D deficiency had complications at a rate of 17.3%, and those that had, compared to people with normal, about 14.6%. That's a difference of about 15%. So having good vitamin D levels may help prevent people from getting as severe of a disease if they do get COVID-19. So that's one reason to keep this up. If you can't get out in the sun, if there's a reason, and the general recommendation is at least 10 to 30 minutes 3 times a week. If there's a reason you can't do that, then what you'd want to do is supplement with about 1,000 international units daily of vitamin D, and that should give you about the equivalent. So this is an easy way to get it, is to get out in the sun, and so vitamin D, good mental health. Now the other reason why it can be very useful to get out has to do with people. For those that are living in an area where there is enough, where the disease may be contained enough, or it's not as widespread, and may be encouraged to get out, outdoors is the best place. That's the safest place to have any kind of interaction with others. It would still be recommended that if you have ongoing transmission in your community, that you would still avoid direct contact, you would still avoid prolonged close contact, and so you'd still want to maintain a separation. But if you're going to have some interaction with someone, outdoors is going to be the safest place to do it. So you still want that 6 feet of separation, but this is a safe place to do it. Good, the air, the good ventilation, you have the sun, and the heat this time of year, and all that is helping reduce concerns with transmission. So that's great. So if you're going to have some interaction, then this is the place to do it. And that is going to help your mental health as well, right? We are social people. We need to interact with others. So get outdoors. That's tip number 2.